Okay, well I'm sharing. Hi. I'm making a video because I'd like to bring your attention to this Genomics England, and I will leave the link for people. So basically this is a website for Genomics England, which is a company that's been set up by the Department of Health in 2013. Now they claim that it's to deliver the 100,000 genomes project. The idea, they claim, is to analyse the genome stroke DNA of a portion of the population as a study. And it started May of this year. So I'd just like to share some research that I've been doing about this whole project. Now, the board members of this Genomics England company include the chairman of the Medical Research Council. It includes the founder of the Wellcome Trust Centre for Human Genetics, the Chief Medical Officer for England and the Chief Medical Advisor to the UK government, and other members who are also in high places, like the chairman of the NHS England and another guy who works for the Data Access Committee of the Wellcome Trust. You've also got an ex-managing director of Goldman Sachs. You've got a company chief financial officer of AstraZeneca, which basically was used to be ICI, and Zeneca was a Swedish company. They joined together. This is the same company, by the way, that is going to be introducing the flu mist to the children of 2 to 17 come August. Now, I've done a video about that you might want to look at. It gives all the information. It shows how dangerous this flu mist actually is. It can penetrate the blood-brain barrier, and the ingredients are dangerous to the young people's health and mind. Okay, so that's on another video. But going back to Genomics England, right, so basically they've started this up in 2013 and it's already started as of March. Okay, now what they're actually claiming on their website, and obviously I'll leave the links, is that they have got 4 companies involved in the initial pilot project. They were picked on a bake-off. They call it a bake-off, where they got 20 odd different companies involved and ask them to tell them what diseases were inside certain genes, and these 4 companies supposedly won. Well, I've looked at these companies, and these companies are actually all linked to the project. So I don't believe for a minute that they were actually, happened to win any bake-off. I think that's a load of rubbish. Okay, now one of the companies is called Congenica Limited, and it uses the technology developed by the Wellcome Trust and Department of Health, and they've got this technology is called Sapienta, and it's been used already in universities in Oxford and Cambridge and all these medical universities. Now, the other members of the company include ex-director of the Medical Research Council, another guy who's actually worked on the 1,000 genome project and the 10,000 genome project. So these are the pioneers of the project, basically. So there's no way that these people have won a bake-off. They were actually involved in the whole thing, and that's why they've been chosen. And it makes you wonder why they've got to pretend they're any different. That makes me suspicious straight away. Why don't they just say these people were involved in it and these are the ones who are going to be dealing with it? But no, it was a bake-off and they were the best ones. You've got another company there. It's called, well, there's 4 companies they reckon that they've given the the project in the first year for analysis, and another company is called Omicia, OMICIA. So so once again, Omicia's just the same. You've got people there who are involved in the Wellcome Trust, people connected to the Medical Research Council and the project itself. So this is not something that it's not true. They didn't win any bake-off. I mean, it's just very highly unlikely, given that these are the same people who've created the technology who've made it. Now, what they're trying to say in their website is that they are going to study the genome stroke DNA of about 70,000 people. They reckon 40,000 people will be people with diseases, illnesses, and the rest will be members of their family. They've set up 11 centres for genomes in December 2014. These are centres, one of them is the Cambridge University Hospital. So here we've got a company set up by the Department of Health. Its board of directors are people in high places, including Dame Sally Davis, who basically is a chief medical officer for the government. You've got someone who is one of the chairmen of the Wellcome Trust, and these are people who stand to make money out of this technology. So I've been doing a bit of looking, a bit of digging, and I wanted to find out, what was going on with it all. So like I say, I'll share the link with you. One of the things I want to say also is I've noticed whilst doing my research that basically the Council for Medical Research, who's heavily involved in this, remember the members are actually involved in the companies who are getting the contracts. Council for Medical Research was set up in 1911, and what happened was the national insurance contributions were helping, and they decided they needed to do research. Now they've got an advisory committee. Now what I found is that the people on the advisory committee who decide who gets research funds and who doesn't are actually giving it to themselves. So they're basically researching themselves. They're also, they're all scientists, professors, doctors, etc., working in hospitals or universities. So they get all the research funds from the same company who they are actually deciding who gets it for, if you like. And then they work on certain technology. They also get paid by the pharmaceutical companies to work on it, as well as getting paid for research by certain charities. And they then go and create a company which either gets bought by the big pharmaceutical company or they're already part of a big pharmaceutical company. So the whole thing is a big scam, and it's all being paid for by taxpayers' money. Now, excuse me. Now I could go into all the people I've looked into. What I'm saying is these companies that are involved, you've got people who are actually within the project. The project started with a 1,000 genomes project, 10,000 genomes project. You've got people who are the directors of cancer research. You've got the people who actually created the software, which is the Wellcome Trust. So basically this whole thing is for the benefit of Big Pharma. Okay, there's no doubt about it. They are entrenched in it all the way through. So I just thought I'd let people know about this. Now, according to them, on this website, you can find all this stuff out for yourself. You go and look on the website. What they intend to do is charge people £250,000 to be part of it. Sorry people, biopharmaceutical companies. £250,000, or smaller companies £25,000, and they want some of the royalties of any products. Now, what you've got to ask yourself is, where is this actually going? Now, the founder of, the pioneer rather, of this technique that actually enables computers to map this, and it's a huge task apparently. The first case of it actually being done cost £100 million. So basically they were trying to wait till it was you could do it for I think they said 1,000. Once it got to £1,000 where you could map a whole genome of a person, that's when the big, the big guns were going to step in and start using the technology for their own financial purposes. Now, so yeah, they're going to be using this technology. Now, like I said, the pioneer of the technology worked with two other people, and one of them was a mathematician. You'll have to excuse me, I've got bloody notes everywhere. So one of them was a mathematician. Now, this guy actually stated, I'll find his name out in a minute, he actually stated, right, I've got it here, the pioneer was Jeffrey Savitz, and with Mark Boguski and a mathematician called Peter Tonelato. Okay, they started the open source gene annotation pipeline. Now, he stated, this is the Tonelato guy, said that databases do not belong with the government. He said government is not a healthcare delivery organisation. So these pioneers knew that, if you've got databases that are basically government owned, which obviously they are if it's Department of Health, this is very, very dangerous. And when you think about the fact that pharmaceutical companies already at the moment there's a big question mark under pharmaceutical companies for what they're doing, because they knowingly allow products that are actually harming people to go on the market and get approved by the FDA. And funnily enough, one of the companies involved, which is Amicia, or OMICIA, one of the people who are on the directors is on the board of the FDA. So there's no possible way they're going to turn these things down and say, oh no, you can't use that. No, because the same people, you've got the same people basically who are creating the research, getting the funding for the research and making the profits from it and giving it the okay to be passed to the public. Okay, it's a complete and utter I don't know what word I can even use. It's disgraceful, because they're basically using taxpayers' money to create whatever it is that they actually create that causes health problems to the public. I mean, I've looked at a lot of the stuff that I've looked at, and they know that this is causing problems to the public. They don't actually care. So, why should we believe that a pharmaceutical company or the government or anybody else involved is creating these sorts of this technology for the benefit of the public? And the implications are something that I don't think people realise, exactly, because, we talk about Agenda 21. Agenda 21 is not some figment of someone's imagination. It's actually something that's been documented. They openly talk about the fact that there's too many people and they need to do something about it. Now, who's to say legislation wouldn't come in, you know, that people would be terminated if they you know, if the genes are pointing towards they're going to have some sort of disease later on that's going to cost money to to fund, or even children, you know, in the womb could be having like genetic testing to see whether or not they're going to develop something in the future and then be terminated because of that, or anything, you know. The possibilities of what they could do with this technology are disturbing, to say the least. You know, I mean, it's basically it's basically a follow-on from the eugenics program, is what it is. So I'd like people to have a look at the website, and I'd like people to kick up a fuss, hopefully, about it, because conflict of interests are rampant, and you've only got to look at who's involved with this new company that Department of Health has set up, and the pharmaceutical companies, the fact that the people who are involved in it are also getting paid by the same people. They even put it down as conflicts of interests in their own. If you look at the Medical Research Council and go and look at some of the members and look at their conflicts of interest, they actually state, oh, I've got such and such 50,000. Well, basically they've got to say if they get more than £50,000 grant per year from whoever they get it from, they have to state who it is. So they will say, oh yeah, I get, you know, I get more than 50. They're not saying how much, but they say, yeah, I get more than 50 grand a year from Wellcome Trust or whoever's paying them. Okay, it's a travesty. It's a travesty of justice, and it's absolutely disgraceful that these people are getting away with it. So I'll leave that with you. Thanks for listening, and I shall leave the links under the video. Okay, thanks.